everyone, I am Kim Liana and I am at CSA. The last procedure Dr. Contessa did for me was jaw sculpting about 7 months ago, and till now my jaw is still well defined. Today I'll be getting treatments. First is microneedling and follow up for my TrapTox. As you can see, my trapezius muscles are quite big because they're overactive. And TrapTox will help ease that pain and tension. Plus, it will give me a longer, slimmer neck. Before continue watching this video, please like, subscribe, and hit the notification bell to stay updated.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up, Miss Kim Liana.
Hello po.
Welcome back.
Thank you, Doc.
So we did a procedure called female jawline contour, or the definition of the jawline for women. Yan. So up to now, we can still see that well-defined jaw of Miss Kim Liana, and I'm looking at her face. Actually, her face is so well contoured and just the right Kim Liana, okay? So, highlighting the beautiful parts of the face, like for example, in the mid-face area, on the lower part of the face, and we were able to achieve that for Kim Liana. Now, we are doing a procedure to boost those kinds of treatments we're doing on you. So, we have this treatment whereby we can maintain that very good skin quality of yours. So well-maintained closed pores, smooth skin, tight skin. So we're looking into skin quality treatment today. So that's one. That's one. Okay. And another one will be a treatment, very specific treatment we call TrapTox. So what is that TrapTox? Okay. Trap is for the muscle trapezius. Tox is for the botulinum toxin. So this is a kind of treatment for those who have concerns on their trapezius muscles here. Yeah, like spasm or any discomfort there, or pain, or like when you touch it, wow, Miss Kim, what's inside this? It's really so hard, okay, and it's so spastic. So it will give you that sensation of discomfort, okay? So for individuals who have this concern, actually right now, we do a treatment called TrapTox, okay? So what will that be? How are we going to perform it? We'll show you when CSA Medical Aesthetics returns. So we're back. We're starting with the so-called TrapTox for Kim Liana. So we're working on the shoulder part here, this from the base of the neck here up to this area here. So what we do is actually make a demarcation of the borders of the muscles, especially the muscles that are spastic. So this part here, I can see a bulge actually. So we can make a straight line, horizontal line from this base of the neck down to the shoulder part. And then also we'll make a vertical line here, and we can actually make it kind of like a rectangle here, and we'll subdivide this part so we can make it into 4 divisions actually, 1, 2, 3, 4, and then we can still subdivide it further into this kind of like 8 boxes here. So for every box, we'll give some injections of our botulinum toxin. So same thing on the other side. Now, we have prepared a product, a botulinum toxin. Usually we dilute it first, and then with my practice, like per side, the number of units will depend on how spastic the problem is, or also the muscle mass, and like how bulgy the muscle mass is. Like I have here a 1 syringe And I could just subdivide this. I can start with like for every injection point, 5 units, 5 units, 5 units, 5 units. So that's gonna be like a total of like 10, 20, 30, 40 units per side, okay? So I'm just gonna inject here and then aspirate. And then just push the starting for 5 units there. Same thing here, okay? So this is already like kind of like a therapeutic Botox injection. So Botox actually started as like therapeutic medicine, not really cosmetic. It was utilized by our neurologists, by our ophthalmologists, and even in other practice of medicine, they actually use this as a therapeutic medicine. Like even in gastroenterology and even in other, like even neurologists, they use it for some treatment of some conditions. Okay, so actually we're done on the right side. Let's go to the opposite side. Okay, we're done on the left side. So we have done TrapTox for Kim Liana. Now let's proceed to our next treatment. We'll be doing the so-called Eladerm for Miss Kim Liana. In the past, remember Kim, you have some problem here on the forehead area. We did the Hollywood Spectra treatment. And then we also had the so-called Hollywood carbon peeling, or the so-called kind of like a Hollywood laser peel, right? Now we'll combine it with this so-called radiofrequency microneedling device, and this will further improve the skin texture, the quality, collagen stimulation as well, tightening, firming, closing the pores. Not only the face, but we will include your neck part. Okay, so this is a device, an energy-based device utilizing radiofrequency plus the microneedling. Okay, so I'll start with the forehead part on the right side first, okay? So this one here, it has this spray here. Later on, we will feel some spray there. Okay, you had it right. So that spray is a cold spray. It's like a low temperature. They told me it's around negative 20 degrees Celsius to help in numbing the skin, okay? Even if you didn't have any, for example, anesthesia, numbing anesthesia there, it's fine. Are you okay with that? Okay. So we're working on the forehead part first, and it has this micro pins, 25 micro pins, and they reach the so-called reticular dermis, where we have those fibroblast cells that will synthesize your new collagen, elastin, and even glycosaminoglycans. You're still okay? Yeah. So the micro pins are micro needles, super sharp needles, and actually they're so good inside the reticular dermis. They can really work into the dermis layer, whereby they can induce those collagenesis, elastogenesis, as well as neoangiogenesis. You feel that cold spray? Okay. So that will help in reducing any pain, any discomfort. And the good thing with this cryo spray, it prevents any kind of so much bleeding. You'll just see some redness on the skin. Okay. Right now, I can see redness on the forehead area, or erythema, which is normal. So the end point usually is erythema and some what we call microedema in the skin, some tiny follicular edema, which is normal. So I'm working on the right side of the face first. Then I will show our audience how to work on the neck part. So I'm utilizing the same depth here, the same power, and also the same frequency. Actually, this device has dual frequency 1 and 2. So the one is reaching more of the upper dermis layer, or your upper reticular dermis layer actually. And the 2 megahertz will be the one that's gonna go into the deeper area. Okay, let's do the neck part. So for our patients with loose skin in this area or sagginess or laxity already, this is a good treatment for you. And those with some neck wrinkles, okay? For Kim, she's young, so this is more of a pre-juvenation, prevention. So I would recommend that you start early. Don't wait for severe wrinkles to come out or too much of sagginess or laxity. Don't wait for that because our collagen gets depleted. Like in a year, you know, they were reporting like 1 to 2% of our collagen is already gone in a year, and each year it continues to get depleted. Although in our biochemistry textbook, I've read that it's on a daily basis that we get this protein degradation, which is actually natural, but our system is able to resynthesize all these molecules, macromolecules. Okay, you're still good? So I'm working on the neck part, and this is just doing the first pass. Now we also can utilize this device for areas with pigmentation. Those with concerns of melasma, it was reported that it can already help in the reduction of the melasma area. Okay, so we'll work on the opposite side. Okay, so we're done with our radiofrequency microneedling using our Eladerm. And the next part will be applying a so-called skin booster. It's Flabium. And Flabium is enriched with a lot of micronutrients. It has amino acids, hyaluronic, vitamins, minerals, and also growth factor peptides that our skin will need to regenerate, to repair from inside. So we'll just be applying it onto the skin. Okay, so this is already like the skin is already treated with the so-called microneedling device. It created micro channels, so our micronutrients can already go inside the reticular dermis, where we need all these components to be able to regenerate the skin and maintain that rejuvenated look for Miss Kim. So you are doing a so-called pre-juvenation, not actually rejuvenation, because you're still young. You're so young. Your skin is well maintained. How young are you again, Kim? 25. Aging starts at 25. So you need some treatment already. So it's just applying it onto the skin and have it like, you know, go inside the inner skin layer. And then after this, we will still be doing some Healite or our low-level light therapy. And also we'll be applying some soothing gel and also like a modeling mask to complete our regimen of our treatment for Miss Kim Liana. So there you go, Kim. Thank you so much. So we'll show the result when CSA Medical Aesthetics return. And we are back. So let's show the outcome to Miss Kim Liana. Although this is radiofrequency microneedling treatment, we still expect redness, erythema from the treatment because we have just done it. And then we will also be doing some of the Healite, low-level light therapy, plus some application of our soothing gel, plus the modeling mask after this. So, how are you, Kim Liana? How was the experience?
Okay, Doc.
It was okay.
Yes po, hindi siya talaga masakit at excited na ako to see the
Right.
final results.
Yeah, I think this is the only painless radiofrequency microneedling device because of the cryogen cooling spray that it has. So it's able to reduce any pain or discomfort. And then the redness is just very temporary. It will be gradually clearing away in a little while. So a while ago, it was really a lot redder on the neck, but right now I'm seeing it like the redness is gradually going away already. Okay, and plus we already applied the skin boosters And actually, you can add exosomes and other like those stem cells or all those derma boosters to help in the skin repair and skin regeneration. So this is a very good treatment for like individuals like Kim Liana, who's always busy, on the go, and wants to maintain her good skin quality and also prevention already. Okay, 25 eh. So this is more of the prevention. Plus, of course, she's still experiencing acne problems. So we want to tighten the pores, the skin pores, and somehow also reduce the marks from some pimples that we had in the past, right? So this is a treatment that's, of course, it's prevention of aging, it's anti-aging, anti-wrinkles, anti-lines, plus also for acne, active acne lesions, or even acne scars, we can use this device. It will restore also the skin's elasticity, especially on the neck, for those individuals who have concerns on the neck, like for example, the laxity of the skin or the neck wrinkles or those with bands there, or loose skin or sagginess there. You can utilize this device for treatment of those concerns. And actually, we can use it for those, for example, stretch marks on the abdomen, on the arms, on the legs, or others with loose skin on the arms, on the legs, or on the tummy. We can use this device. So body parts, we can also use this not only on the face and neck. And we also had reports of utilizing it for axillary hyperhidrosis or excessive sweating on the axillary region or the palms or plantar areas. So many applications for this device. So hindi siya masakit, right?
Hindi po.
Yeah, because there were radiofrequency microneedling device that was reported to be painful because of those so many micro pains. Yan. Plus, the radiofrequency only delivers the right amount of energy. Plus, there's an optimal temperature with this kind of device. Yan. Thank you.
Thank you, Doc.
You want to share with our audience? Yeah.
Okay. Take care of your skin po.
Exactly. Take good care of your skin and your health.
Invest in it po.
Right. Plus, also the shoulder pains, neck pains, if you're experiencing that. Actually, we still do some evaluation or like a physical assessment, what's going on. So, like procedures like this, in our clinic, we still get your history. We still talk about like what are the medications you're taking, any past medical conditions you had, or past procedures you had. So we're still like, you know, clinical in our approach. We still rule out any medical conditions like that. Yun. So this one, actually I need that too. Sometimes if you're carrying a lot of loads. No. See, you're doing workout right now. Yeah, because I noticed you're becoming physically fit, which is good. Exercise is very essential, and right diet is very essential. Proper sleep or right amount of sleep. Ilang oras ka ba natutulog? Yan, because you know, we're talking about treatments like this. We also advise healthy lifestyle. Avoiding sun exposure, too much sun exposure. Some individuals, they love going under the sun, okay? Just put on your sun protection cream, your sunblock. And also, like, yon, adequate sleep, exercise, proper diet. Ano ba?
Water.
And hydrate. Plus, of course, yung healthy lifestyle. Kasi some individuals, they smoke, they, you know, alcoholic drinkers, like that. So if you can avoid those, avoid. For like a younger look, because any unhealthy lifestyle can accelerate aging. There you go. So we'll see the result of the TrapTox. Usually we tell our patients like in a week or two, we check them again. And the treatment Eladerm, we do like an interval of this one. You can do like a every 2 to 4 weeks interval. And we do it in sessions as well. Thank you so much, Kim Liana. Yeah. Thank you to our audience. Please also watch the other videos of Kim Liana. I don't know how many episodes we had already. Please check out our YouTube channel, Contessa Salvador. And yun, always subscribe and click the like button. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917504268. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.